How do disease states alter toxicokinetic parameters in animals? Diseases like liver cirrhosis, renal failure, or gastrointestinal disturbances significantly affect ADM processes. In renal failure, for instance, the clearance of aminoglycosides like gentamicin is reduced, leading to accumulation and nephrotoxicity. Similarly, in hepatic lipidosis in cats, reduced enzyme activity impairs drug metabolism, prolonging the half-life of drugs like diazepam. Even diarrhea or ileus can alter oral absorption, changing both onset and intensity of toxicant action. What is the importance of blood flow rate in tissue exposure? Organs with high perfusion like the liver, kidneys, lungs, and brain receive more of the toxicant per unit time, making them early targets. For example, inhaled anesthetics quickly affect the brain due to high cerebral blood flow. Conversely, fat and bone receive less blood, so toxicants like lead accumulate slowly but persist longer. Understanding organ blood flow helps predict both the speed and site of action or damaging toxicity. How does tissue affinity impact toxicant persistence? Tissue affinity refers to a toxicant's chemical attraction to specific tissues. For example, tetracycline binds strongly to calcium, leading to accumulation in bones and teeth. This can cause discoloration in young animals or delayed release effects. Similarly, organochlorines like DDT prefer adipose tissue, remaining stored for months. Tissue affinity prolongs half-life and complicates residue elimination, making withdrawal periods longer. What is the relevance of the partition coefficient in PBPK modeling? The partition coefficient determines how a toxicant distributes between tissue and blood. A high tissue-to-blood coefficient means the substance prefers tissues, while a low value indicates it stays in circulation. For instance, thiopental has a high partition coefficient in brain tissue, explaining its rapid but short-lived anesthetic effect. In PBPK models, accurate partition coefficients allow for realistic simulations of tissue concentrations over time. Why are plasma levels not always indicative of total toxicant burden? Plasma levels may be low even when toxicants accumulate in fat, bone, or intracellular compartments. For example, lead may not show high blood levels in chronic exposure because it hides in bones. Similarly, lipophilic drugs like ivermectin may reside in fat, showing low plasma levels yet exerting prolonged effects. Hence, relying solely on blood levels can underestimate true body burden, especially for depot-forming substances. How do physicochemical properties of toxicants influence absorption? Properties like molecular size, ionization, and lipophilicity affect a substance's ability to cross biological membranes. Lipophilic compounds like nicotine or organophosphates penetrate skin easily, while large, polar molecules like heparin require injection. Weak acids are absorbed better in the stomach, low pH, while weak bases prefer the intestines, higher pH. This understanding helps predict which routes of exposure are most hazardous. What role does gastrointestinal motility play in oral absorption? GI motility affects how long the toxicant remains at its absorption site. Delayed gastric emptying, for example, due to opioids or stress, can slow absorption of weak bases. Rapid transit, for example, diarrhea, may reduce overall absorption. For example, oral drugs like digoxin require sufficient gastric contact time, so GI disturbances may lower bioavailability. In toxicity cases, motility also affects how long decontamination, emesis, charcoal, remains effective. What are rate-limiting steps in toxicokinetics? A rate-limiting step is the slowest step in a toxicant's ADM process, which determines its overall disposition. In flip-flop kinetics, absorption is slower than elimination, making it rate-limiting. Conversely, for drugs like cisplatin, renal excretion is rate-limiting due to slow clearance. Identifying the rate-limiting step helps optimize antidote timing, sample collection for diagnostics, and duration of therapy. Why is the concept of steady state important in repeated exposure? Steady state is achieved when the rate of toxicant administration equals its rate of elimination, resulting in a constant plasma concentration. In repeated dosing, for example, daily NSAID therapy in dogs, toxicants with long half-lives may accumulate and cross toxic thresholds. For instance, repeated phenobarbital use requires monitoring trough levels to avoid neurotoxicity. Understanding steady state is key in managing chronic exposures. How can toxicokinetics guide environmental exposure assessment? Toxicokinetics helps estimate internal dose after environmental exposure such as pesticide residues in feed, inhalation of ammonia in poultry sheds, or dermal contact with disinfectants. For example, if a goat grazes on endosulfan-contaminated pasture, toxicokinetic models can predict when milk residues will drop below safety limits. This supports regulatory compliance, public health decisions, and outbreak management.